Welcome to this educational program. This module discusses the management and treatment of rhinosinusitis, inflammation of the sinuses. Other modules are available that describe other aspects of the sinuses and rhinosinusitis. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. The paranasal sinuses, or sinuses for short, are the four pairs of mucus-lined hollow spaces inside the bones of the face and skull. They are located on either side of the nose, the maxillary sinuses, in between the eyes, the ethmoid sinuses, behind the eyes, the sphenoid sinuses, and in the forehead, the frontal sinuses. Though their exact function is unknown, it is thought that the sinuses help to warm, humidify, and filter inhaled air, regulate pressure within the nose, contribute to immune defense, lighten the weight of the skull, give resonance to the voice, absorb shock from blows to the face, and contribute to facial growth. By producing half a liter to a liter of mucus each day, which empties into the nasal cavity, the sinuses contribute greatly to air filtration. Mucus is swept into the nasal cavity by tiny hairs called cilia, beating nearly 1,000 times a minute. Regular clearance of mucus, called mucociliary clearance, helps keep the sinuses hollow and sterile, and any disruption of this could lead to sinus inflammation and infection. The inflammation, or swelling, of one or more sinuses is called rhinosinusitis. It can be caused by anything that impedes airflow into the sinuses and/or mucus clearance out of the sinuses, brought on by such factors as infection, allergy, irritants, anatomical obstruction, foreign bodies, disease, dryness, and certain medications. Symptoms of rhinosinusitis include facial pain and pressure, nasal congestion and discharge, headache, fever, bad breath, cough, tooth and ear pain, and diminished sense of smell. Rhinosinusitis may be acute or short-term, chronic or long-term, or recurrent, meaning repeated, and may rarely spread, sometimes causing serious disease. Treatments for rhinosinusitis aim to lessen symptoms, reduce sinus inflammation, treat infection, promote mucus clearance, maintain open sinuses, and prevent complications. Treatments include remedies, or actions to provide relief, medications, drug therapy, and surgery. Although home remedies cannot cure rhinosinusitis, they can provide comfort. Sinus pressure and pain may be soothed by breathing in steam, using a humidifier, getting plenty of rest, drinking plenty of fluids, applying moist heat over the sinuses, or flushing out the nose with solution called nasal irrigation. Steam moisturizes the sinuses and stimulates mucus drainage by constricting tiny nasal blood vessels, though excessive direct heat may actually impede function of the cilia. Humidity speeds mucociliary clearance, which is slowed when mucus becomes thick in dry environments. Rest ensures the health of the body's immune system to fight any infection, and drinking hot or cold fluids dilutes or thins out mucus secretions and promotes drainage. Moist heat will ease facial pain, while flushing the nose will wash out stagnant mucus. Heavy mucus crusts are too heavy for the cilia to move. Sinus relief may also come from eating certain spices and condiments. Garlic contains the same chemical found in a drug given to make mucus less sticky. Horseradish contains a chemical similar to one found in decongestants. And cayenne peppers contain capsaicin, a substance that acts as a natural nasal decongestant. Exercise may also help to relieve rhinosinusitis, as the adrenaline it releases constricts blood vessels and reduces swelling. And finally, rubbing sore sinuses brings a fresh blood supply to the area and can offer some relief. Rhinosinusitis symptoms can also be relieved with such medications as saline sprays, decongestant sprays, corticosteroid sprays, oral decongestants, oral steroids, antihistamines, antibiotics, mucus thinning medications or mucolytics, antifungals, and pain relievers. Immunotherapy or allergy shots may also help, and if rhinosinusitis symptoms do not improve after medical treatment, surgery may be required. The next few slides discuss all treatments in more detail. Saline or saltwater sprays ease rhinosinusitis symptoms by moisturizing the nasal cavity and helping to clear out dry mucus. Some physicians recommend hypertonic or very strong salt solutions, while others recommend isotonic or equal concentration solutions, such as a mixture of 1/4 teaspoon salt and 1/4 teaspoon baking soda dissolved in 1 cup of water. Decongestant nasal sprays are also available and work quite quickly, within 1 to 3 minutes. These contain the ingredients phenylephrine, oxymetazoline hydrochloride, xylometazoline, or nafazoline. Decongestant sprays constrict the swollen, dilated blood vessels in the nose and sinuses, allowing mucous membranes to shrink and air passages to open. Though decongestants create the feeling of airflow in the nasal passages, their excessive use actually inhibits the ability of the nose to warm, humidify, and filter incoming air, sometimes producing a rebound effect, whereby congestion recurs. For this reason, nasal decongestants are recommended only for short-term use and are not normally used for more than 3 days. Oral decongestants contain the active ingredients pseudoephedrine, phenylephrine, or phenylpropanolamine. They work much slower than nasal sprays do, usually achieving their effect within 15 to 30 minutes, and are absorbed throughout the entire body, working on all small blood vessels. Because of this systemic effect, patients with heart disease and high blood pressure may be at increased risk of complications from oral decongestants. As with the nasal decongestants, oral decongestants may also become less effective with prolonged use. The rebound phenomenon also exists in oral forms, but is not nearly as severe. Corticosteroid nasal sprays contain the ingredients beclomethanazone dipropionate or triamcinolone acetonide. Steroids are potent inflammation inhibitors, and nasal steroid sprays work directly on inflamed linings of the nasal passages and sinuses. With little effect on the rest of the body, they may be used for long periods of time. Like steroid nasal sprays, systemic or oral steroids also inhibit inflammation, but are absorbed throughout the body. They are safe and very effective in certain complicated instances of chronic disease and are not often used in less severe instances. Antihistamines block the action of histamine, the chemical in the body responsible for the congestion, sneezing, and runny nose of an allergic reaction. They therefore relieve sneezing and congestion and also increase the movement of mucus. Antihistamines are used to treat rhinosinusitis typically only if allergies are a main factor of the symptoms, and they are also known to dry out mucus. Patients can feel better initially on antihistamines because of initial decreased volume of fluid within the sinuses, but once drying and therefore subsequent infection kicks in, rhinosinusitis symptoms usually return. Mucolytics are drugs that thin the mucus for better clearance from the sinuses. These include oral guaifenesin, potassium iodide, or iodinated glycerol. They can sometimes be found in combination with decongestants. Antifungals come as nasal sprays, oral, or intravenous injected medications, and are used to treat sinus infections caused by fungi or mold. Reaction to fungus inside the sinuses is rare, and the complexity of fungal infection requires that the use of antifungals be under the guidance of an ear, nose, and throat specialist. Fungus can also be treated with topical and systemic steroids and can be removed from the sinuses surgically. Some over-the-counter medications are highly effective in reducing painful rhinosinusitis symptoms. The primary ingredients in most over-the-counter pain relievers are acetylsalicylic acid, or aspirin, acetaminophen, or Tylenol, ibuprofen, such as Advil, naproxen, or a combination of them. Antibiotics destroy bacteria in the sinus cavities and are usually prescribed for 10 to 14 days, sometimes for less. They can be given by mouth, inhaled through the nose, or administered by intravenous injection. Clearing infection helps prevent rhinosinusitis complications, relieve symptoms, and reduce risk of acute inflammation becoming chronic. Most patients recover from acute rhinosinusitis within about 3 weeks. For chronic rhinosinusitis, however, it may take an extended period of time for the sinus inflammation and infection to be completely treated. Chronic rhinosinusitis treatment often occurs for a minimum of several weeks, sometimes for several months. Patients usually start to feel better, though, within several days after starting medical treatment. Some possible side effects of sinus medication include jitteriness, nervousness, drowsiness, lightheadedness, dizziness, difficulty concentrating, a rapid heartbeat, difficulty sleeping, nausea, rectal itching, bloating, vaginal yeast infections, burning during urination, and fatigue. Please consult your doctor for more detailed information on sinus medication and its possible side effects. In addition to medication, a doctor might also suggest allergy testing to rule out any allergy to dust, mites, mold, animal dander, or pollen. An allergy consultation will reveal which environmental factors worsen symptoms and predispose to rhinosinusitis. Immunotherapy, or allergy shots, is a form of allergy treatment that involves giving an individual gradually increasing doses of an allergen, an allergy trigger. The incremental increases of the allergen cause the immune system to become less sensitive to the substance, which reduces the symptoms of allergy when the substance is encountered again. Fortunately, most rhinosinusitis patients will not require surgery. 90 to 95% of them can be effectively treated with medical therapy. But for those individuals who suffer from persistent rhinosinusitis that is unresponsive to medication, sinus surgery is sometimes the only option. Surgery is performed by an ear, nose, and throat specialist, also called an ENT surgeon or an otolaryngologist. Surgery works to clean and drain the sinuses, widen the sinus openings, remove fungal infections, remove physical obstructions such as nasal polyps and tumors, and to repair a deviated septum, which is a crooked wall between the nostrils. Sinus surgery can be traditional or endoscopic. In traditional sinus surgery, the sinuses are accessed through an incision or cut made inside the mouth, or in various parts of the face. Working through the incision, the surgeon can remove obstruction in the sinus or leave a temporary opening to help drain mucus. Endoscopic surgery can be less invasive and more precise than traditional surgery, and is the type most often performed today. It is performed most often on an outpatient basis, requiring no overnight hospital stay, and its risk, discomfort, and swelling are minimized. In endoscopic surgery, a long, thin telescope called an endoscope is inserted into the nostrils, allowing the surgeon to examine inside the sinuses and guide instruments to remove sinus obstruction. In the majority of cases, the surgical procedure is performed entirely through the nostrils, leaving no external scars. Endoscopic surgery takes 1 to 2 hours. Sometimes a simple clearing of the nasal cavity is all that is required to relieve rhinosinusitis symptoms, in which case local numbing medication or local anesthetic is given and the patient remains awake. For the removal of deeper blockages, polyps, or tumors, and for straightening a deviated septum, however, medication to put the patient completely asleep, called general anesthetic, is usually given. After sinus surgery, a patient will need a ride home, as anesthesia can cause drowsiness and disorientation for some time afterward. The patient's nose may be covered with a gauze dressing that will need to be changed if dirty or wet, and some packing will be placed in the nose after surgery, usually worn for only a few days. Pain after surgery is usually mild, though a full recovery may take several weeks, and severe inflammation may take months to settle down completely. Dried blood and mucus may likely be found in the nose, and a saline spray can be given to help keep the nose moist. Following sinus surgery, a patient may be asked to avoid strenuous activity and swimming for a number of weeks. Some medication might be prescribed, and follow-up appointments will likely be required. Careful post-operative care and proper follow-up are very helpful to obtain optimal results. Possible complications from endoscopic sinus surgery include infection, bleeding, recurrence or persistence of symptoms, voice change, since altering the structure of the sinus through surgery can affect resonance, injury to the eye, which is very rare, and injury to the brain, also extremely rare. Although not all sinus disorders can be prevented, a number of things can help prevent rhinosinusitis. Some doctors may recommend quitting smoking, avoiding smoky environments, drinking plenty of fluids, decreasing alcohol intake, reducing outdoor exposure to airborne allergens or pollutants, getting a flu vaccination, taking decongestants during a cold, using air conditioners, humidifiers, and air filters inside home and work, and treating allergy when required. To summarize, treatment for rhinosinusitis includes home remedies such as steam, humidity, rest, moist heat, nasal irrigation, certain spices and condiments, medications such as decongestants, steroids, antihistamines, antibiotics, mucolytics, antifungals, and pain relievers, immunotherapy or allergy shots to reduce allergic reaction, and surgery, including traditional and endoscopic techniques. Please consult your doctor for more information on rhinosinusitis treatment. Other modules in this series include Understanding Rhinosinusitis, What are the sinuses, and The Pathophysiology of Rhinosinusitis. Here are just a few of many resources available to educate you on rhinosinusitis. These references may also assist you. We sincerely hope that this module has furthered your understanding of treatment for rhinosinusitis. We wish you the best for the future, and thank you once again for viewing this educational program. And no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. The paranasal sinuses, or sinuses for short, are the four pairs of mucus-lined hollow space. Sinuses help to warm, humidify, and filter inhaled air, regulate pressure within the nose, contribute to immune defense, lighten the weight of the skull, give resonance to the voice, absorb shock from blows to the face, and contribute to facial growth. By producing half a liter spaces inside the bones of the face and skull. They are located on either side of the nose, the maxillary sinuses, in between the eyes, the ethmoid sinuses, behind the eyes, the sphenoid sinuses, and in the forehead, the frontal sinuses. Though their exact function is unknown, it is thought that describe other aspects of the sinuses and rhinosinusitis. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature. Welcome to this educational program. This module discusses the management and treatment of rhinosinusitis, inflammation of the sinuses. Other modules are available